rhinoplasty is a secondary procedure after someone has had a rhinoplasty and is unhappy with the results, where we're going back to correct things. Some of the differences are obviously the natural cartilage has been affected in some way, and so there's a little bit more surprise, if you would, because you don't know what they've done. And you also sometimes don't have enough cartilage to work with, in which case we're taking cartilage, for example, from the ear to have extra building blocks to work with. So a lot of times with revision rhinoplasty, the problems could be the whole extent of just not enough was done or too much was done. A lot of times the things that you will see is problems with nostril visibility. A lot of times if there's too much rotation and arching of the nostril margin, people are unhappy with, because anything that looks unnatural, that draws attention in a way that you don't want it, is something that people are going to be unhappy with. The whole goal of rhinoplasty is to give you a nice nose that looks like it belongs. And for that to happen, it shouldn't look too upturned, it shouldn't look too small, it shouldn't look too like it doesn't belong on you. So the key to a natural rhinoplasty is making sure the proportions fit, the tip blends with the bridge of the nose or the dorsum, and that the whole nose fits in with the rest of the facial features. So for revision rhinoplasty, when patients come in, it is helpful to, I always start with, I want to really drill down on what you're unhappy with, what things we really need to address. It's important to establish those things so I can answer, okay, what can we do, what can't we do, and make sure that we have appropriate expectations for the end result. I do an examination, look on the outside, look on the inside. And then importantly, with the photos that we take, I can do a morph of the image. And when I do a drawing, it's something that I think is realistic. It's not an exact, but it can give a close approximation of what we can expect. And it helps ensure that we have the same goals. So what I think is going to be realistic, what I think is achievable, is something that the patient is here is also going to be happy with. The standard answer that people will give is approximately 1 year from surgery before you go back and do further surgery. And the rationale for that is you really want to let swelling go down, have a real good idea of what the new baseline is, where we're working from before you go back in. Now, 1 year is a little bit arbitrary, and if something is really bad or very problematic and we have a good idea that it's not going to change much by waiting those extra couple of months, there are occasions when we'll go back and do it sooner. Downtime after a revision rhinoplasty is variable, even just like a primary rhinoplasty. Everyone bruises differently, everyone swells differently. So much of it will depend beyond just the individual. Some people bruise more easily than others, but the other factors are, what are we doing? So if the bones need to be manipulated, that's going to usually be associated with more bruising and swelling. If it's more just tip work, we're going to have a quicker recovery in most cases. All the rhinoplasties that I do are open rhinoplasty, where there's an incision just in the columella, and it's placed in a way where it's going to camouflage very nicely. If someone had a closed rhinoplasty previously, I am going to proceed with an open rhinoplasty, and the incision there is not a previous incision there. If a prior open rhinoplasty was performed, if the incision is in the right spot, then I will just use that same incision. If I think it is in a place where it is not favorable or would be problematic, then I'll place it in a spot that is more favorable.